Is there a doctor in the house, please? A doctor in the house, please. Doctor.
Our current healthcare system is, well, how would you put this? It's in the danger zone. Hi, this is H. John Benjamin, and I'm here to talk healthcare.
We're in the richest country in the world, and my man can't get his legs sewn up?
Today, more than 30 million Americans still don't have health insurance, and even more are underinsured.
No insurance.
Even for those with insurance, costs are so high that medical debt is the #1 cause of bankruptcy in the United States.
Tennesseans are being forced into bankruptcy.
Credit completely destroyed.
$7.8 million worth of medical bills.
We spend significantly more on our national GDP on healthcare, far more per person than any other major country.
We should be having by far the best healthcare system in the world because we're spending so much money.
And despite spending more, Americans actually have many worse health outcomes and a higher infant mortality rate than countries that spend less.
If I bought a car for $50,000 and you bought a car for $25,000, I have every reason to believe that my car is going to be a lot better car than your car.
We have a responsibility as Americans to ensure everyone has actual health care.
Oh, really? I'm sorry. I thought this was a free country. I didn't know we were in communist Sweden.
If we were living in Sweden, we'd have universal health care.
We need to be spending our dollars on doctors, nurses, mental health specialists, dentists, and other professionals. We must invest in the development of new drugs and technologies that not waste hundreds of billions of dollars a year on profiteering, huge executive compensation packages, and outrageous administrative costs.
Don't take this personal, Doc. Y'all a bunch of goddamn crooks.
Sheesh. The giant pharmaceutical and health insurance lobbies have spent billions of dollars over the past decades to protect their greed and ensure that their profits come before the health of the American people.
I'll strip you of everything you hold dear, or I drag you down to a sordid death.
When we all stand together, we're going to be able to take on the insurance companies and the drug companies and Wall Street and everybody else, and to do what we should have done decades ago.
Joining every major country on earth in guaranteeing health care to all people as a right, not a privilege, through a Medicare for All single-payer program.
You will no longer be writing checks to private insurance companies.
Making healthcare free at the point of service. No premiums, no copays, no deductibles, no surprise bills. And no having to be an accountant to figure out how to submit your bills for reimbursement. Also, make sure the most any patient has to pay out of pocket for prescription drugs is $200 per year. And to do all this, we need to elect the only candidate who's been fighting for a just healthcare system since before many of us were even born. I'm talking about, of course, Senator Bernie Sanders. Bernie's been talking about the same damn issues for 4 decades.
We want national health care.
We need a single-payer national health care program.
I bet you're wondering, how the hell are we the richest country in the history of the world, and yet we still don't have a universal health program? The short answer? Corporate greed. Hi, this is H. John Benjamin, and yes, I am still talking about healthcare in America. In the 1930s, FDR proposes a new deal to help combat unemployment during the Great Depression. And although he tries including a national health insurance plan,
right to adequate medical care, the opportunity to achieve and enjoy good health,
he's faced with lobbyists like the American Medical Association, the largest trade group for doctors. So he ends up dropping it like a hot potato. During World War II, employers are unable to offer wage increases, so employer-sponsored health coverage becomes a new way to compensate employees. That's great for some people, but it leaves out the unemployed, the retired, the disabled, or even folks whose bosses simply don't offer insurance, laying the foundation for the broken system we see today. In 1948, President Harry Truman takes another stab at implementing universal health care. He takes over FDR's old national health insurance platform to provide public coverage for all Americans rather than just the working class and poor citizens.
I've repeatedly asked the Congress to pass a health program.
Some members of Congress don't like that and immediately fire up the fear-mongering rhetoric, calling the plan socialist, and even suggesting that it reflects the ideals of the Soviet Union, adding to the Red Scare hysteria that's already gripping the nation. Sound familiar?
We are alarmed by the new calls to adopt socialism. Socialism. Socialism.
Socialism. And the AMA isn't about to miss out on the fun. They introduced their own plan in opposition, proposing private insurance options. They spend millions of dollars persuading people that insurance for profit is the way to go. And Truman's proposal dies. In 1961, President Kennedy introduces Medicare to help those 65 and over with hospital bills. And of course, the AMA tries to muck it up again. They pay then-actor Ronald Reagan to record an ad against Medicare.
The key issue is we do not want socialized medicine.
And in 1963, President Kennedy is assassinated. So Lyndon Johnson takes on the fight.
All I have, I would have given gladly, not to be standing here today.
With the help of a Democratic Congress, President Johnson finally creates Medicare and Medicaid, giving the federal government a role in taking care of the elderly, disabled, and poor. In 1 year, nearly 20 million seniors in more than 12,000 hospitals enroll in a new Medicare program. In 1971, Senator Edward Kennedy proposes to take Johnson's accomplishment even further with a national plan that would include all Americans. But Nixon shoots that down.
This is a private enterprise one. All the incentives are toward less medical care.
In the 1980s, Reagan happens.
I forgot what I was going to say.
He cuts Medicare, Medicaid, and loosens regulations so more private companies can profit from your health care. Bill Clinton tries to reverse the damage and proposes a middle ground solution that mixes universal coverage and private insurance.
To have a combination of private market forces and a sound public policy.
This plan goes nowhere. But Clinton does manage to pass the Children's Health Insurance Program, CHIP, for kids 18 and younger.
Since I signed the CHIP program into law, 2.5 million children have been able to get insurance through this program.
George W. Bush then modifies Medicare to include an optional program called Medicare Part D, which uses private companies to cover the costs of prescription drugs.
They never stop thinking about new ways to harm our country and our people, and neither do we.
Seniors, beware of Republicans bearing gifts. Today, the president signed a Trojan horse.
Around that time, the conversation surrounding healthcare slows down in America quite a bit because, well,
American and coalition forces are in the early stages of military operations to disarm Iraq.
It isn't until election campaigning starts in 2006-2007 that talk about healthcare picks up again. March 23, 2010, President Obama signs the Patient Protection and Affordable Care Act, otherwise known as Obamacare.
And there was much rejoicing.
Just kidding. Of course not.
Obamacare is a disaster.
Train wreck.
Families don't even feel like they have health insurance.
Prior to the Affordable Care Act, about 1 in 7 Americans were denied health coverage due to pre-existing conditions like asthma or cancer. With Obamacare, all Americans are mandated to buy insurance with the help from the government. And with Trump, that mandate was repealed, undercutting the core of the ACA. By the time 2020 campaigning rolls around, everybody's talking about a radical, bold, new idea.
Medicare for all.
Medicare for all.
Medicare for all.
Medicare for all.
Medicare for all, single-payer system.
In fact, the first 45 minutes of the second Democratic debates is entirely dedicated to whether or not we're ready to move to a single-payer healthcare system.
You don't know that,
Second
Bernie.
of all,
We'll come to you in a second,
I do know,
Congressman.
and I wrote the damn bill.
But the reality is, Medicare for All is not new. In fact, our man, the one and only Bernie Sanders, has been fighting to implement healthcare for as long as he's been in politics.
And what we have got to do is move toward a single-payer system, which essentially says to the 1,500 private insurance companies, thank you, you've had your day, we can no longer afford to keep you.
Bernie once said in a 1986 interview that he
will continue to rock the boat until justice is done.
And true to his word, the boat rocks on.
How are you going to pay for this?
How are we going to get the money to pay for that?
The truth is, we are already paying for our broken healthcare system.
Why are you so shocked by this?
Hi, this is H. John Benjamin, still talking about the healthcare crisis in America. Right now, we spend over $3 trillion a year on a crappy, broken system.
Price is wrong, bitch.
We pay about twice as much per person as our friends in Japan and Germany. And for what? To have over 30 million people uninsured and over 40 million who can't afford the insurance they have.
I think I want my money back.
We're already projected to spend more than $50 trillion over the next 10 years for a system only a big pharma executive could love. A lot of that money comes from the government, but the rest, it comes from you. This would change for the better by moving to a Medicare for All system that will actually save you and everyone else in America a whole lot of money.
Help me, I'm poor.
Don't take that from me. Take it from a conservative study backed by the Koch brothers. Let me explain how. First, let's talk taxes. I know, that's bad, but let's do it. What Republicans and the for-profit healthcare industry don't want you to understand is that we're not talking about new money. We're talking about money that's currently being taken right out of your pocket by drug and insurance companies. Let's call this money the corporation's tax you tax. For example, the cost of an employer health plan for a family of 4 is $28,000, over $12,000 of which is paid directly by the employee through premiums and out-of-pocket costs. In fact, if you include healthcare premiums, the United States is already one of the highest taxed nations in the world. All that corporations tax you tax is why the healthcare industry reports over $100 billion in profits last year alone.
From a nurse's point of view, where is all the money going? Why is it so expensive?
It goes into CEO's salary. Sometimes it goes into magnificent atriums in hospitals while they're closing down other community hospitals.
Can you believe?
In place of this, we're going to have a progressive system that saves most Americans some dough. When Bernie is president, we will reverse decades of cutting taxes on the wealthy and make large corporations and the richest Americans pay their fair share. That means higher rates for millionaires, taxing unearned income from Wall Street the same as normal income paid by working people, imposing a fee on the biggest financial institutions, and restoring the estate tax so billionaires finally pay back into the society they profited so much from. We will completely eliminate premiums, co-pays, and out-of-pocket costs and fund Medicare for All with progressive tax revenue.
Oh, yeah!
Second, you don't even want to know how much the United States wastes on processing paperwork. It adds up to hundreds of billions of dollars. We're going to replace this Byzantine system of paperwork and billing with one single payer, Uncle Sam.
That is not where the money should go on paper pushing.
Estimates show Medicare for All could save more than $500 billion each and every year on administrative costs.
Oh, this is it.
It's impressive.
Thirdly, Americans pay more for prescription drugs than anywhere else in the world. Why? Big Pharma.
We're getting ripped off by the drug companies.
Many of these drugs were developed using government research and grants, yet are turned around and sold at sky-high prices to those who desperately need life-saving medication. We're going to stop this outrageous price gouging and cut the costs of prescription drugs for patients in hospitals by more than half. This will save more than $100 billion per year. With a system that produces billions in profits for the insurance industry and drug companies, while tens of thousands of people die each and every year because they can't afford care. The question in the richest nation in the history of the world shouldn't be, can we afford to provide health care to all Americans as a human right?
How many are willing to transition to what the senator says, a government-run system?
That's why it's phrased Medicare for All, which is everyone.